Clinics have been vaccinating some of the youngest Coloradans for COVID-19 for almost a week. Those 6 months to 4 years old are now eligible for the COVID vaccine. There is still hesitancy from some parents to get their kids vaccinated. A Kaiser Family Foundation poll found that 2 in 5 parents say they're going to see how the vaccines work for others before they vaccinate their own children. To talk about the efforts to get more kids vaccinated, we have asked Dr. Eric France, Chief Medical Officer for the State Department of Health, and Dr. Brandi Freeman, a pediatrician at Children's Hospital Colorado, to join us today and maybe clear up some of these things. So we're going to say, let's just start with the fact that why are parents who are vaccinated themselves saying, I don't know if I want to get my kids vaccinated?
I think it's a hard thing for us to understand, but I can understand it. Truthfully, parents are very protective of their children. That's what the role of being a parent is. And so they are trying to get all the information and all the data. And so what I've been trying to tell all of my patients, all of my parents, is that it is safe. The studies were good, they were large, and it is time to get your child vaccinated.
We were just chatting about this in the commercial break, and Dr. France, the same thing is like sometimes you hope that a little bit of time passes and then they start thinking, well, school's starting, or maybe I'm going to go visit the pediatrician's office this summer just for a checkup, and maybe somebody else will give them that nudge.
Yes, I'm a pediatrician for over 30 years, and as we've introduced new vaccines over that time period, there's a group that's knocking on your door saying, we want it right now.
Yeah.
There's another group that says, let me talk with my doctor, and okay, then I'll do it. And then there's a group that kind of waits and wants to see how things go for a while before they jump on. The end result, though, is that a very large majority of people become vaccinated and offer vaccination for their kids. And so I expect there's no reason that won't be the same for this vaccine. It's been very safe, it's effective, and it will be available widely through primary care offices with family doctors, pediatricians, community health clinics, over the summer months, which is when people bring their kids in for preschool checkups and school checkups. So I imagine we'll see a lot of families choosing to have their children vaccinated this summer.
It really is the time to do it. I mean, especially if you have even minor side effects. Like if you say, oh, I don't feel great today, do it in the summer months when you're not in school.
Exactly.
Let's talk a little bit about the spike we've seen, though. We have seen COVID numbers going up as of late. What are your thoughts on that? And what are we really seeing? Because so many of us are concerned that people are doing at-home tests and they're not reporting anyway.
I think that's one thing that's definitely scary for me as well. I think we have seen it. We've seen it within our residency program. We're seeing it in the community. I think some of it is related to we are back and we are doing things and we're really excited. But we just have to remember those things that we did before. Wash your hands, wear your mask, get your booster if you haven't done it yet. Those are things that can help us get through this spike as COVID continues to circulate.
Speaking of Dr. France, we're talking about that booster. It's time for everybody virtually to get it. I know we're just getting with the kids, but do you see that where like everybody needs to get on board with this booster, and then also will this become like an annual thing where we're all going to get shots?
The good news now, of course, is that everybody 6 months of age and older is eligible for the vaccine, and everybody 5 and older is eligible for the booster. And so hopefully we've all had our boosters. I believe that if you've been boosted and you catch COVID, your chances of being in an emergency room, in an ICU bed, in the hospital are much lower. And so really the booster and vaccination is really focusing on keeping people out of the hospitals. For children, it's about keeping them well, preventing any of those long COVID types of symptoms that you can see with kids, and making life easier for families so parents don't have to stay home with sick children or worry about exposure in school or preschool to the same degree.
Plus, we know once one kid in the family gets something, everybody gets it, right? And every other child in the household.
They're good at sharing.
And the parents,
really,
right?
Yeah. Exactly. It's like, come one, come all. Dr. France, Dr. Freeman, thank you so much. You're such great voices of reason, and we hope everybody listens to the good doctor and does what they need to do in the months ahead, and our families stay healthy. Thank you so much.
Thank you.